What if I told you that the swelling in your legs and ankles isn't something you simply have to accept after 60, but rather a signal your body has been quietly sending for years, asking for one specific thing you haven't been giving it? As a surgeon, I've sat across from more older patients than I can count who describe the exact same progression. Shoes that fit fine in the morning and won't close by 3 o'clock in the afternoon. A mark pressed into the skin where the sock was. A heaviness in the lower leg by evening that wasn't there 5 years ago. And almost every single one of them says the same thing when I ask how long it's been going on. They say, "I just assumed it was my age. I figured it was something I had to manage, not something I could actually fix." Here's what concerns me about that assumption. The swelling almost never begins as pain. It starts quietly. So quietly that most people spend years brushing it off before anyone ever examines it closely enough to explain what's actually happening inside the leg. And by the time someone finally does look closely, the circulation changes that cause the swelling have been building long enough that what was once a minor, fully reversible mechanical issue has turned into something that requires far more effort to reverse. What I have seen consistently in my own patients and in the research I have followed for years is that the body in these situations is almost never asking for a compression stocking or a diuretic as its first line of help. It is asking for movement, one specific category of movement that reactivates a system your legs were built with, a system that most people over 60 have unknowingly been letting go dormant, and that when activated correctly produces results most people cannot believe came from something this simple. Today, I am going to walk you through 5 movements. Each one targets a different part of the venous and lymphatic system in the lower leg. Each one has clinical evidence behind it, and each one can be done sitting in any chair in your house in under 3 minutes, without any equipment, without any pain, starting today. But before I show you the movements, I need to show you something first. Because without understanding what is happening inside the leg, the movements just look like exercises. With that understanding, you will see exactly why each one works, and you will do them with a precision that produces real results instead of doing something halfway and wondering why nothing changed. My name is Dr. Harris. This channel exists for one reason: to give adults over 60 the honest, evidence-based health information that a standard appointment almost never has enough time to deliver properly. Before we go further, drop a comment below right now and tell me, do you experience swollen legs or ankles? Is it both legs or just one side? I read every single comment, and your answer actually matters for something specific I'm going to say later in this video. Stay with me through all 5 movements, because movement 3 is the one that surprises people most. It looks almost too simple to do anything, but the vascular research behind it is more convincing than most people expect. And what I cover at the end about the timing of these movements is the piece that determines whether they work within days or take weeks to produce a visible difference. Here is what is actually happening when your legs swell. Your heart pumps blood down through your arteries into your legs without significant difficulty. Gravity assists. The pressure generated by your heart is more than adequate to push oxygenated blood all the way to your feet. That direction down is not the problem. The problem is the return journey. The deoxygenated blood in your feet and your ankles and your lower calves now has to travel back up against gravity, against the full length of your legs, back to your heart, which sits well above your lower extremities and cannot pull blood upward with the same efficiency that it pushed it downward. The body's solution to this engineering problem is one of the most elegant mechanisms in human anatomy. It built a second pump inside your legs. Not a second heart, a muscle pump, specifically the calf muscle pump. Vascular specialists sometimes call it your second heart and mean it literally. When your calf muscles contract, they compress the deep veins running through the lower leg and physically push the blood upward toward the heart. When they relax, the veins refill from below. Tiny one-way valves inside the veins, small flaps of tissue spaced every few centimeters along the vein wall, prevent the blood from falling back down between contractions. Contract, push up, relax, refill. Contract, push up, relax, refill. Research published in the Journal of Vascular Surgery found that the calf muscle pump has an ejection fraction of approximately 65% in a healthy adult. For comparison, a healthy human heart has an ejection fraction of 55 to 70%. Your calf muscle is doing the work of a heart on the venous side of your circulation every time you walk. Now, here is what changes after 60. And this is the part that almost no one explains clearly. Two things happen at the same time. First, the calf muscles themselves begin losing mass and strength, a process called sarcopenia that accelerates from the sixth decade onward. By 70, most adults have lost between 15 and 30% of their peak calf muscle mass compared to their mid-40s. The pump is physically smaller and weaker. Second, the valves inside the leg veins begin losing their structural integrity. They thicken slightly, they become less responsive. Blood that should be moving cleanly upward begins to reflux, to fall back slightly between pump cycles. Pressure builds in the lower venous segments. That pressure drives fluid out of the veins and into the surrounding tissue. That fluid is what you see when you look at ankles at 4 o'clock in the afternoon. And here is the final piece. The calf muscle pump only activates during movement. When you are sitting still for 90 minutes watching television, your calf muscles are doing nothing. The pump is completely off. Blood is pooling. Fluid is migrating into the tissue. And the longer you sit, the more it accumulates. This is a mechanical problem. And the 5 movements I'm going to show you today are a mechanical solution that directly targets every stage of this process. Not a workaround, not a temporary fix. A direct intervention in the exact biological system that is failing. I want to tell you about a patient I will call Dorothy, 72 years old, retired elementary school teacher from outside Nashville, Tennessee. Dorothy was not inactive. She walked to her mailbox every morning. She did light gardening when her knees permitted. She ate carefully, drank her water, kept her sodium low after her doctor recommended it. And every single afternoon, her ankles swelled badly enough that her daughter had started buying her shoes in a size larger than her actual foot because nothing else would go on comfortably after 2 o'clock. Dorothy's doctor had diagnosed her with chronic venous insufficiency and prescribed compression stockings. The stockings took 10 minutes to put on every morning and left her wrists aching. The elevation helped while she was lying down, but she could not spend her entire afternoon horizontal. Her sodium was already low, and reducing it further made no meaningful difference. Every afternoon, the swelling returned as reliably as the sun going down. What nobody had told Dorothy, and this is the part that stays with me about her case, is that the compression stockings were doing half the job of a set of movements she could perform herself in her chair in under 3 minutes, at the exact moment the fluid was beginning to accumulate, treating the symptom rather than activating the system that was supposed to prevent it. I am going to show you what I showed Dorothy, starting with the most important movement of all 5. The first movement is the ankle pump, but performed with a precision that most people have never been shown, because the way most people do this movement on instinct produces a fraction of the clinical result. When most people try ankle pumps, they flex their toes up toward the shin, then push them back down and repeat. That motion uses primarily the small muscles of the foot. It generates weak, shallow compression of the lower veins and produces minimal calf muscle activation. The correct version starts from the heel. You are seated, feet flat on the floor, back supported. Press your heel firmly downward into the floor as if you are trying to push through it while simultaneously pulling your entire forefoot and toes upward toward your shin as far as they will comfortably travel. You will feel your full calf muscle engage, not just the lower portion of the leg, but the entire belly of the gastrocnemius, the large muscle that generates the majority of venous pump force. Hold that full contraction for 2 full seconds, then release completely. Not push forward, just return to flat and neutral. Then repeat. The rhythm is firm contraction, 2-second hold, full release. Research published in the Journal of Orthopedic Surgery and Research confirmed that this pattern, full-range dorsiflexion with sustained contraction, significantly increases both maximum venous outflow and maximum venous capacity in the deep veins of the lower leg. Those are the 2 direct measurements of how effectively the pump is clearing blood from the lower extremities. The 2-second hold is what produces the ejection. Without it, you are warming up the pump, but not fully activating it. Perform 20 repetitions on both feet simultaneously. That takes approximately 90 seconds. That is movement 1. Type the number 2 in the comments right now if you are still here and following along. I want to know who is in this community and when stay with me, because the second movement is the one that most people skip entirely, and it addresses the part of the swelling that the ankle pump alone does not reach. The second movement is the calf raise performed seated. This is different from the ankle pump in a specific and important way. The ankle pump moves the ankle joint through its range while the leg remains stationary. The seated calf raise lifts the heel off the floor by contracting the calf muscle concentrically. The muscle actually shortens under load rather than simply contracting against a fixed surface. That concentric contraction produces a different and complementary pumping action in the deep veins compared to the isometric style contraction of the ankle pump. Sitting in your chair with your feet flat on the floor, raise both heels simultaneously off the floor as high as they will comfortably go. Your toes and the ball of your foot remain on the floor. At the top of the movement, heels fully raised, hold for 2 seconds. Then lower your heels slowly back to the floor. Slowly is the key word. The controlled descent, taking 2 full seconds to lower, produces eccentric calf muscle contraction during the return phase, which research on venous insufficiency management has confirmed adds additional pump activation beyond the upward phase alone. Perform 15 repetitions. The entire set takes approximately 1 minute. Research from a systematic review published in the Journal of Vascular Surgery confirmed that structured calf muscle exercise training in patients with chronic venous insufficiency increased ejection fraction, reduced residual volume fraction, the percentage of blood left behind in the lower vein segment after each pump cycle, and improved muscle strength and ankle range of motion. Every one of those outcomes directly translates to less fluid left behind in the tissue at the end of the day. The third movement is the one that surprises people the most because it looks at first glance almost too gentle to be doing anything significant. It is ankle circles. And I want to explain why this specific movement earns its place on this list before I show you how to perform it. The ankle joint is surrounded by a dense network of small lymphatic vessels in addition to the venous system we have been discussing. The lymphatic system is a parallel drainage system that handles the fluid that leaks out of capillaries and veins into the surrounding tissue, which is exactly what is accumulating in a swollen ankle. The lymphatics cannot be directly activated by calf muscle contractions the way the veins can. They require joint movement. The gentle mechanical compression of the tissue around the joint produced by moving through a full range of motion to stimulate their drainage function. Ankle circles produce that joint movement in every plane simultaneously, creating a gentle mechanical wave through the tissue surrounding the ankle that stimulates lymphatic drainage in a way that the ankle pump and calf raise do not. Lift one foot slightly off the floor, rotate the ankle in a slow full circle, as wide a circle as you can comfortably produce, 10 times in one direction and 10 times in the opposite direction, then switch feet. The movement should be slow and deliberate, full range. You're not trying to create a cardiovascular response. You are mechanically stimulating tissue drainage. Total time for both feet is approximately 90 seconds. Dorothy told me at her follow-up that the ankle circles were the movement she was most skeptical about, and the one that seemed to make the most noticeable difference in how her legs felt by mid-afternoon. That response is consistent with what the lymphatic drainage research would predict. The fourth movement addresses something that the first three do not target directly: the upper portion of the calf and the back of the knee, where the popliteal vein collects blood from the lower leg before sending it upward toward the thigh and eventually back to the heart. This area is a venous junction point. When it becomes congested, which happens more readily in people who sit with their knees bent at 90 degrees for extended periods, it creates a bottleneck that reduces the effectiveness of everything the lower calf pump is doing. The movement is a seated knee extension. From a seated position, slowly straighten one leg until it is fully extended in front of you, parallel with the floor. Hold for 2 seconds at full extension. You will feel a gentle stretch behind the knee and in the hamstring. Then slowly lower the leg back to the starting position. Perform 10 repetitions on each leg, alternating sides. The extending motion creates movement through the popliteal fossa, the soft tissue behind the knee, and gently mobilizes the popliteal vein, reducing the venous congestion that accumulates at that junction during prolonged sitting. Combined with the calf activation from the first three movements, this clears the pathway upward so the blood being pumped from the lower leg has an unobstructed route toward the heart. If you are still here and getting real value from this, type the number 4 in the comments right now. Your comment genuinely helps this channel. And the fifth movement, which I am covering in a moment, is the one that determines how long the results of the first 4 last. Get that timing wrong, and you will see partial results. Get it right, and the difference between morning and evening swelling starts to disappear within the first 2 weeks. Before I show you the fifth movement, I need to give you the information that I consider the most important in this entire video. And it is the information that most health content on this topic skips entirely because it complicates a simple protocol video. I am not going to skip it. There is a type of swelling in the legs that looks identical to the venous insufficiency and pump failure swelling I have been describing, sits in the same location, responds temporarily to the same interventions, but has a completely different cause and requires a doctor's evaluation before any home protocol begins. The first warning sign is one-sided swelling. Everything I have described today, venous insufficiency, calf pump failure, lymphatic congestion from prolonged sitting, affects both legs, not necessarily equally, but both. If your swelling is isolated to one leg only, and particularly if that leg is also warmer than the other, tender to the touch in the calf, or producing a deep aching sensation that feels like cramping, stop and call your doctor today. Do not wait for the next available appointment. Do not try ankle pumps and see if it helps. One-sided swelling with those accompanying features is a clinical presentation of deep vein thrombosis, a blood clot in the deep vein of the leg. DVT is a medical emergency because a clot that forms in the leg can travel through the circulation to the lungs and become a pulmonary embolism, which is immediately life-threatening. The home movements I am showing you today are not appropriate for DVT. They require anticoagulation therapy and urgent imaging. The second warning sign is swelling, accompanied by shortness of breath, particularly shortness of breath that is new, that worsens when you lie flat, or that wakes you from sleep. This combination can indicate congestive heart failure, in which the heart's reduced pumping efficiency causes fluid to pool in the body's lowest tissues, the legs, the ankles, the feet. It looks like venous insufficiency. It behaves similarly, but its cause and its appropriate treatment are entirely different. If you have lower leg swelling with any degree of unexplained new shortness of breath, that is a conversation for a doctor, not a home movement protocol. The third warning sign is skin changes over the swollen area. If the skin over your lower legs or ankles is darkening, taking on a brownish or reddish-brown discoloration, thickening in texture, or developing areas that break down or will not heal, these indicate advanced venous disease that has moved beyond conservative home management. Vascular surgery evaluation is appropriate. Procedures exist: thermal ablation, sclerotherapy, structured compression therapy programs that address the underlying vein pathology directly. They are covered by most insurance plans when the clinical indication is documented, but they require a specialist assessment. If none of those three apply to you, both legs are affected, no new shortness of breath, no one-sided pain or warmth, no skin changes, then what you have is almost certainly the mechanical problem I described earlier, and the protocol I'm showing you today is the right first intervention. The fifth movement is the standing heel raise, and it is the most powerful calf pump activation in this entire protocol. I saved it for last specifically because it is the one that requires you to stand, and I wanted you to have a complete seated protocol available for moments when standing is not practical or comfortable before introducing the most effective option. Stand behind a chair, both hands resting lightly on the back for balance. Your feet are hip-width apart, parallel, pointing straight forward. Rise up onto the balls of both feet simultaneously, heels fully lifted off the floor as high as you can comfortably go. At the top, hold for 2 full seconds, then lower your heels slowly back to the floor, taking a full 2 to 3 seconds on the descent. Do not drop back down. The controlled lowering is half the exercise. Perform 15 repetitions. When this is performed correctly, full rise, 2-second hold, slow controlled descent. The calf muscle contraction generated is significantly more forceful than any seated version of the same movement because you are now working against the full load of your body weight through the calf. Research on structured calf exercise for venous insufficiency patients found that this type of loaded calf contraction produced the greatest improvements in venous ejection fraction of any exercise studied, the percentage of blood cleared from the lower leg veins per pump cycle. For someone whose ejection fraction has declined with age and inactivity, restoring even a portion of that function visibly changes what the legs look like by the end of the day. Now here is the timing piece that determines whether this protocol works within days or takes weeks to show visible results. Most people, when they start an exercise protocol for swollen legs, do the exercises once and then check their ankles at 8 o'clock at night and feel disappointed that nothing has dramatically changed. Here is why that happens and how to avoid it. The ankle pump and the calf raise and the standing heel raise are most effective when used before the fluid load becomes significant, not after the ankles are already visibly swollen. Fluid accumulation in the lower leg tissue builds across the hours of sitting. By 4 o'clock in the afternoon, when the shoes will not close, you are managing a fluid volume that has been accumulating since 10 o'clock in the morning. The pump at that point has to work against an established fluid burden. That is harder and takes longer. The protocol that produces the fastest visible results is this. First session in the morning within 30 minutes of waking while the legs are at their least swollen. All 5 movements in sequence, total time is approximately 12 minutes. Second session in the early afternoon, not the evening, at approximately 1 o'clock or 2 o'clock before the afternoon swelling peaks. Third session in the late afternoon, around 4 o'clock, at the point when the swelling historically begins to be noticeable. 3 sessions per day of 12 minutes each, 36 minutes total, spread across the day, at the moments when the pump is most effective, rather than the moments when the fluid load is already at its worst. Dorothy started with 2 sessions per day, morning and early afternoon, because the 3-session schedule felt ambitious for her first 2 weeks. Within 3 weeks, her afternoon swelling had reduced enough that she was back in her regular shoes by 5. Within 6 weeks, she was back in them at 3:30. Her daughter called my office and told me her mother had cried the first morning she put on her own shoes without struggling. She said, "Why did nobody tell her this years ago that she could do something this simple and it would actually work?" There is no complicated answer to that question. The information exists in the vascular surgery literature. It is not obscure. It is just not being delivered. Not in standard appointments that have 15 minutes to cover everything. Not in the general wellness content that oversimplifies the mechanism and undersells the solution. This channel exists to close that gap. 4 questions to bring to your next appointment if you are managing lower leg swelling. 1. Is my swelling from venous insufficiency and calf pump dysfunction, or should we rule out other causes first, specifically cardiac and lymphatic causes? 2. Would a venous duplex ultrasound be appropriate to assess my valve function and severity? 3. Are any of my current medications contributing to my lower leg edema? And if so, is there an alternative? Calcium channel blockers, certain diabetes medications, and NSAIDs are among the most common pharmaceutical contributors to lower leg swelling in adults over 60. 4. At what point would a referral to a vascular surgeon be the right next step for my specific situation? Not because surgery is imminent, but because knowing the threshold is information you deserve to have. If this video gave you something real today, a clear explanation of what is actually happening, 5 movements you can start tonight, and the timing that makes the difference between partial results and real ones. Please hit the like button, share this with someone you care about, the spouse whose ankles have been swelling for years and who has accepted it as permanent, a parent who spent good money on compression stockings that take 10 minutes to put on every morning and never address the mechanism underneath, a friend who walks carefully now because their balance feels different than it used to, and nobody has ever connected that shift to what is happening in their circulation. Subscribe if you want more of this. Evidence-based, plainly explained, built specifically for adults over 60 who are managing their health with real commitment and deserve information that is just as careful in return. Drop a comment and tell me, which of the 5 movements are you going to try first? And if you experience swelling in only one leg, not both, please go back and read the warning signs section of this video before starting. That distinction matters. Next week, I'm covering the 5 silent signs that appear in your feet and lower legs that vascular surgeons consider early warnings of circulation changes, signs most people dismiss as normal aging that can actually give you a window of 2 to 3 years to intervene before the problem becomes significantly harder to reverse. If your circulation has been on your mind, you will not want to miss that one. I am Dr. Harris. Take care of yourselves. I will see you on the next one.